Brilliant. Well, hello. Welcome to, I believe it's our fourth bipolar self-management webinar. My name's Simon Kitchen. I'm the Chief Exec of Bipolar UK, and I'm really delighted to be doing this webinar in partnership with the National Centre for Mental Health at Cardiff University, which is one of the leading research institutes for bipolar in the country and probably in the world itself. And we've got a really amazing all-star cast with you here today. So we've got John, who's a psychiatric nurse, and we've got Alice, who's a clinical psychologist research assistant. I want to get it right, Alice. I don't want to let you down on that. And also we've got Professor Ian Jones, who's probably got more titles than the Queen. I think he's a consultant psychiatrist and a professor, and probably got quite a few doctorates as well. So it's going to be a really fantastic session. And today we're focusing on friends and family. And as a charity, Bipolar UK, we're about supporting everyone who's affected by bipolar. So that's people living with the condition, but also the close friends and family that obviously the condition has a massive impact on. And people often don't like to use the word carer because it's your loved one, it's your family, but a lot of people do take on caring responsibilities.
Simon, I think we're losing you, so I wonder if we should.
Okay, I wish I'd known. Can you hear me now? Is it getting better?
Yeah, you're back now. Sorry,
Brilliant,
Simon.
I'm back. Sorry, I was going off on one there, wasn't it? It shuts me down when I'm windbagging. So I'll hand you over now to John, who's going to give you a short presentation and then hopefully be able to do a bit of follow-up as well. John, over to you.
Thank you, Simon. So we've been running the bipolar education program courses for about 10 years now, and part of the course is using Beating Bipolar, which is an internet-based program, and we're going to use some of the videos tonight. And the first video we're going to show is from Beating Bipolar, and it's hearing from family and friends of people with bipolar disorder about how they feel. So QVT, as they say.
Being the carer of someone with bipolar disorder can be very difficult, but it's also one of the most rewarding experiences you could possibly have.
When he's going high, he can be brilliant to be with. He's full of fun and energy and full of life. He's really funny. The kids love it. We all know now, though, that this doesn't last. Very soon, he just gets irritable with everybody, really angry. Not just with me, but with the kids as well.
I think all family members have a responsibility to tell their loved ones when they are not well, but the secret is to do this in a patient and very supportive way.
Well, it's difficult being a friend sometimes. When she's well, she's great, but sometimes she's a bit of a pain. When she's depressed, it can be a bit difficult to be around her, and it makes me feel terrible to say it, but she just seems really tied up in herself. She just doesn't seem to think about anyone else. You know, the thing is, I know it's not what she's really like. Normally, she's the most kindest, she's the most thoughtful person I know, and that's what makes it seem so unfair. You know, this illness that makes people behave out of character. You know.
When he had his breakdown, we had to agree to him being put into hospital. That wasn't very easy at all. To see him there broke my heart. There was so much that makes you feel guilty. You look at yourself and wonder if things could have been different. Sometimes I think the doctors and nurses blame you. They think it's all your fault. One doctor once told me that I shouldn't be so involved, like I should take a back seat or something. It made me furious at the time. Finally went into hospital.
Hi, so Alice speaking now, and I'm just going to get a presentation which we've got for you all this evening. So hopefully you can see it. So as is probably clear from that video, you know, everyone's experience of having a loved one with bipolar will be different. But perhaps some of what was talked about in that video resonated with you and your experiences. But I guess, you know, the aim of what we're going to be doing tonight is to talk a little bit about the role of kind of family and friends within the kind of management of bipolar disorder. But first of all, we thought it would be helpful just to run through perhaps a little bit about what bipolar disorder is and what it's not, because there are a lot of misconceptions about bipolar disorder. So first of all then, bipolar is a common long-term mental health disorder, and although it's unknown exactly how many people have bipolar, it has been estimated to be as high as around 5% of the population, and that obviously means that there's an even greater number of family members and friends in the UK who have a loved one with bipolar. And although everyone experiences changes in mood from time to time, those with bipolar experience more extreme changes characterized by episodes of depression or mania and hypomania. The severity of episodes can vary, but however, episodes can generally kind of impact an individual's ability to work, maintain relationships, and engage in other important areas of life. And sometimes individuals may also require more intensive treatment to manage mood episodes. So for example, from a community mental health team or in an inpatient setting. Unfortunately, however, it can take a long time for people with bipolar to receive an appropriate diagnosis. And some estimates suggest that on average it can take around 9 years. Delayed diagnosis may occur for a number of reasons. So individuals may be misdiagnosed due to symptoms of bipolar being common to many other disorders such as anxiety, substance misuse disorders, and psychosis. It's also possible for bipolar to co-occur with such disorders, which can further complicate diagnosis and treatment. So I'm just going to hand you over to John now, who's going to talk a little bit about the causes involved in bipolar disorder.
Thank you, Alice. Well, researchers haven't been able to identify one cause for bipolar disorder. It is, however, believed to be a complex interaction between a number of biological and environmental factors, including genetics, life experiences, social and psychological factors. Now, although some causes may be common to many people, the exact combination of contributing causes will likely be very much individual. As we will discuss, a number of treatments exist for bipolar disorder, including medication, talking therapy, psychoeducation, and lifestyle approaches. However, just as there isn't one cause for bipolar disorder, there isn't a one-size-fits-all when it comes to treatment. We should also cover some common misconceptions about bipolar disorder, including the following shown on the screen. It clearly isn't a trendy new diagnosis. Depression has probably been around since the dawn of time, and certainly there are references in classical literature about bipolar disorder, formerly called manic depression. And it's certainly not the fault of the person, nor is it a character flaw or a personality defect. It's a neurological condition.
So I guess what then does bipolar disorder look like to those living with the disorder and also to their friends and family? And I guess, as John's already kind of touched on, so everyone's experience of bipolar and effective treatments for their symptoms will be different. However, there are a number of symptoms that may be common to episodes of depression and mania. So typical symptoms of depression may include some of those listed on the slide here. So having episodes of low mood, experiencing a lack of enjoyment in previously enjoyed activities, changes in appetite and sleep, poor concentration or motivation, reduced energy and activity, becoming quite kind of socially withdrawn, perhaps experiencing symptoms of anxiety or even psychosis, and also perhaps thoughts of or acts of self-harm. Typical symptoms of mania then might include feeling especially elated or irritable, speaking a lot faster than usual, having lots of ideas or thoughts, planning things which seem out of character, again changes in appetite, perhaps a decrease in appetite, also poor sleep, quite often it's a decrease in sleep, becoming more sociable, perhaps engaging in reckless behaviour, and also possibly having grandiose beliefs or psychotic symptoms. So I'm just going to come out of the PowerPoint for a second and show you another video. So just bear with me whilst I get that up. So this time, again, we're going to hear from a father about his son's experience of bipolar.
Seeing John going through all he's been through has been very hard indeed. I think we knew for a long time before he finally went into hospital that he wasn't well. As a teenager, he used to get a bit really down at times. At the time, we just thought he wasn't anything out of the ordinary. They're all miserable at that age, aren't they? But looking back, I think it was more than that. When he had his breakdown, we had to agree to him being put into hospital. That wasn't very easy at all. To see him there broke my heart. There was so much that makes you feel guilty. You look at yourself and wonder if things could have been different. Sometimes I think the doctors and nurses blame you. They think it's all your fault. One doctor once told me that I shouldn't be so involved, like I should take a back seat or something. It made me furious at the time. What I've come to realize is John needs different support at different times. For a lot of the time he's doing great and I'm just in the background. Sometimes though he needs a lot of help with the practical things as much as anything else. I have to watch myself though and let him be grown up and don't take over everything all of the time.
So perhaps again, some of what John's father had to say resonated with your experiences as well. So bear with me a second whilst I just go back to the PowerPoint and hand over to John to speak a little bit more about treatments for bipolar.
Thank you, Alice. Many people with bipolar can benefit from a range of approaches for managing or treating the symptoms that Alice just talked about. But just as everyone's experience of bipolar will be unique, what works for one person might not necessarily work for another. Research indicates, though, certain approaches may be helpful for many people, including medication and talking therapies, as well as educating people about their symptoms. Psychoeducation, which is the aim of the BEPC program. Such approaches are best used in combination, and often a trial and error approach is needed to find the best approach for an individual. In addition to formal interventions, research suggests that making even very simple changes to lifestyle can really help people gain some control over their symptoms and to manage these more successfully in the long term. As family and friends, it may be especially helpful for you to be aware of these.
Yeah, so important areas of lifestyle then to consider as family and friends of people living with bipolar include the importance of establishing regular routines, sleep, exercise, diet, and avoiding alcohol and recreational drugs. So it may sound quite boring, but research has shown that alongside treatments such as medication and talking therapies and psychoeducation, keeping a regular routine and being mindful of lifestyle and factors that might have an effect on mood can be highly effective ways to stabilize mood and help to prevent episodes of depression and mania. So why is this then? So disturbed sleep is a common symptom of mood episodes, and it can also be a trigger for them. So during low mood, some people sleep less and others a lot more than usual, whereas in high mood, typically people sleep less and can sometimes go for days without any sleep at all. And it's thought that the parts of the brain that are responsible for sleep and mood are closely linked, and that this might help explain why getting an appropriate amount of sleep is essential to helping to improve mood stability. Exercise can also be hugely beneficial for both physical and mental well-being, and studies have shown that it can have antidepressant effects associated with the release of endorphins. Many people therefore find that it's a useful way of helping to take control of their mood. However, during episodes of mania and related to an increase in energy, some people can feel inclined to exercise excessively. And even though it might feel like a good way of using up that excess energy, it is advisable not to overdo it. So John, I don't know if you wanted to talk a bit more about the importance of diet and avoiding alcohol and recreational drugs.
Wow, thanks, Al.
Sorry. Ooh.
Aside from being essential to our survival, eating regular balanced meals, as Alice is talking about, can also assist with physical and mental well-being, and may indeed contribute to mood stability. Problems with alcohol and drugs are unfortunately very common in those living with bipolar disorder. Some people might use drugs or alcohol in an attempt to relieve anxiety or depression, and during mania may increase the use related to be more sociable, or a desire to even maximize euphoria and elation. Unfortunately, both drugs and alcohol can, however, interfere with sleep and cause mood symptoms that mimic bipolar disturbances, and can make an underlying mood disorder worse and less responsive to medication. And it's really advisable to moderate alcohol consumption, avoiding excessive amounts, but to avoid wholeheartedly the use of recreational drugs. As family and friends, it may be possible to encourage a loved one with bipolar to establish routines and behaviours which can assist with mood stability, whilst discouraging behaviours which may trigger mood episodes. But it's not always easy.
No, absolutely. And I guess, as we've touched on then, so in addition to lifestyle factors that we've just talked about, so such as disruptions to sleep and substance misuse, it may be possible to identify a range of other triggers for mood episodes. And some are likely to be important for everyone, but others may be very much individual. And as part of the BEPC course, we ask individuals to think about their triggers by completing a chart like this one. So again, triggers include unique individual triggers, as well as those which are common to others. So perhaps lifestyle factors, work, relationship or family problems, social activities might also be a trigger. Also things like money problems and medication as well. So managing or avoiding these triggers once identified can be a really effective way of reducing the likelihood of mood episodes occurring. And being aware of your loved one's unique triggers is likely to enable you as family and friends to help them to manage or avoid these, should you be able to. And it's also important to note as well that another common trigger for mood episodes in women with bipolar are hormones, especially related to changes in hormones following pregnancy and childbirth. So approximately 1 in 4 childbirths are thought to trigger a mood episode. And it can be extremely helpful for the families of women with bipolar to be aware of this possibility, so that they may be able to provide support or access help as needed. And this is actually something that we're hoping to cover in a bit more detail in a webinar that we're planning over the coming weeks. So just on to the next slide then, which talks a bit about mood monitoring. So over to you, John.
Thank you. Somebody's asked me to put my video on. I don't know who it was.
Oh.
I don't know why, but you can see me reading from the script now, so sorry. So as well as identifying triggers, it's also very helpful for those people with bipolar disorder and those around them to make a habit of monitoring mood using a mood scale such as the one we're showing here, which is the one from Bipolar UK. Mood monitoring has been thought to be one of the key skills that you can learn to effectively manage bipolar disorder. It can help with recognizing when everyday changes in mood are beginning to get out of hand, and is also very good for spotting relationships between what's going on in your life and how it might affect your mood. And there's different, some people like to monitor the mood on a daily basis, and some people like to do it throughout the day, and other people will do it over maybe a week or a few days. And you've really got to find your own way of doing it. And if you look at this mood scale, for lots of people, it won't actually, if you look at the ones for points 10 and 0, for lots of people, it won't be as extreme as that. And you need to personalize the mood chart to your own symptoms for it to have the best effect, really.
Yeah, so
There you go.
Yeah, thinking about mood charts then, like the one that John's just shown you, and being aware of triggers, like I talked about, can also help individuals with bipolar disorder to think about early warning signs which can occur in the weeks before a mood episode. And these can include changes in thoughts, feelings, and behaviours. So identifying early warning signs can enable individuals to then create what's known as an early warning signature, as well as a plan consisting of steps to take to help manage changes in mood, which may be an early sign of relapse. So we call that a relapse plan. And although early warning signatures and relapse plans may not always help to prevent or actually manage to prevent episodes from occurring, effectively using them has been shown to increase the time to relapse, reduce admission times, and improve social functioning and work performance. So we get people who take part in the BEPC programme to try and fill in a template like this one to help them think about that.
And friends and family may, again, be able to help identify early warning signs and also be central to having a relapse plan. For example, having identified early warning signs, an individual may recognise that seeking support from family and friends is one part of their relapse plan. You might be able to help them take steps to have a more positive lifestyle changes, such as prioritising sleep, reducing alcohol consumption, or talk to them about how they're feeling and try and distract them from difficult thoughts they might be having. When individuals complete the early warning signature as part of the BEPC course using a template such as the one showing now, we emphasise that it might be helpful to share this with family, friends, carers and health professionals, and even to ask their help in creating it should they feel comfortable doing so.
Yeah, and an important part of that relapse plan as well then, for those who attend the course, we also encourage them to create a contact sheet using a template like this one. And so as you can see, this consists of up-to-date details of key individuals involved in their care. And this can help to make it quicker and easier to contact the right person in an emergency or once early warning signs have emerged. And again, we encourage participants to share this with friends and family if they feel comfortable doing so, as there might come a time when, as friends and family, you may need to contact those involved in their care on their behalf. So thinking about kind of psychiatric crises then, on the next slide here, we've just got an audio clip, which I'm going to play, which talks about what you might be able to do in a psychiatric crisis.
Unfortunately, at some point in the future, your friend or loved one may experience a crisis related to their bipolar disorder. There are some very simple and practical steps that you can take to help stop this happening. Most of what follows is basic common sense, but these things can be very important for many people living with bipolar disorder. Make sure they have regular contact with a health professional who knows them well. For many people, this will be a psychiatrist or community psychiatric nurse, but it might also be their GP. Encourage them to take their medication regularly. Always do this in a supportive and non-confrontational way. Encourage them to try other treatments for bipolar disorder, such as cognitive behavioural therapy, counselling or group therapy. Put them in touch with your local branch of the Manic Depression Fellowship. You may want to join up yourself. When they are well, have a full and frank discussion about what they would like you to do for them should they become very depressed or very manic. This will include a discussion about going into hospital and the pros and cons of using the Mental Health Act. This is the kind of thing you should also discuss with your friend or loved one's psychiatrist or GP, with their consent, of course. Agree on a plan when there is evidence that they are experiencing early signs of relapse. This might involve taking some extra medication or simply getting them an earlier appointment with their GP, CPN or psychiatrist. In some cases, it might also involve taking away their credit cards to limit spending, taking away their car keys to keep them safe from reckless driving, and even taking away their passport to stop them travelling overseas. Regular routines are critical, particularly with regard to sleeping, eating and exercising. Encourage them to monitor their moods using a diary if things seem to be getting worse. Drugs and excessive alcohol are potentially disastrous for many people with bipolar disorder. Try to discourage drug use altogether and encourage only moderate use of alcohol. Finally, if a crisis occurs, ask for help sooner rather than later. Make sure you have the correct numbers for the GP, the CPN and the psychiatrist, including the numbers to phone out of hours. Many families often try to look after a friend or loved one who is becoming unwell for too long. Remember that many episodes can be nipped in the bud with fast and effective treatment, and that services have developed in recent years, such as crisis intervention teams and home treatment teams, which allow most people to be managed within their own home rather than in hospital.
So hopefully that kind of provided some key things that you might be able to do in a crisis, although it also summarised some of the things that we have already talked about. So back over to John then to think a bit about how you can be a positive influence then.
Thank you, Alice. So we've mentioned some things that you can do as family and friends to support a loved one with bipolar disorder. And to summarise some of it, firstly, find out, if you can, more about bipolar disorder, and hopefully this evening will help you find out more. Secondly, as we've touched on, you may be able to assist your loved one to form regular routines and support their well-being. Be aware of triggers and lifestyle factors which may contribute to mood episodes or be symptoms of one. And you may also be able to discourage your loved one from engaging in unhelpful behaviours. Related to this, you can also learn to recognise early warning signs, take practical steps to help your loved one should they wish this. And finally, it can be extremely helpful to have all the important context to hand in the event of a crisis situation. It may also be important to remember that during a mood episode, your loved one may lose insight into their symptoms and be reluctant to accept your help. And this is where it may be useful to agree together, whilst your loved one is feeling well, what steps they would like you to do as part of the relapse plan in case this happens.
Yeah, so in addition to what we've already talked about then and the points that John's just summarised, so there are a few other key points which might be helpful to remember when supporting somebody with bipolar disorder. So firstly then, try to remain realistic. Even though treatment and lifestyle changes can assist with managing symptoms, mood episodes are still likely to occur. But try and remain positive and remember that living with bipolar is a continual learning process, both for those with a diagnosis as well as for loved ones. And be prepared to act fast in crisis situations, as we've already kind of touched on. And I think has been said a few times already, agree with your loved one perhaps in advance steps you might be able to take to help them. And I think really important, remember that your loved one may have bipolar, but this doesn't define who they are as a person. So try and separate the illness from the person, and remember that difficult behaviour may be a result of the bipolar and not the person themselves. And also try not to take things personally. So sometimes as a result of the bipolar, and I think this was touched on in some of the video clips that we had, your loved one may say or do things sometimes that make you feel offended or rejected. It may therefore be helpful to openly talk about both the positives and the negatives of your relationship and bipolar, but try and focus on the positives. A trusting and supportive relationship can be mutually beneficial and make all the difference to you being able to effectively support one another. And lastly, but definitely by no means least, I think it's so important to remember to look after yourself. It really isn't possible to pour from an empty cup, and supporting a loved one with bipolar, although as it was touched on earlier, that it can be rewarding, obviously for your relationship with them, it can also be, very challenging at times. And in order to support them as best you can, it really is crucial that you make your own well-being a priority. So try and remember to do those things which, are good for you as well. Ooh. Over to John again.
So this is what we call a stability postcard. And it's not an acronym, is it? There's a word that means that each individual letter means something, but it's like an acronym. And so each letter of the word stability can be helpful pointers in maintaining a balanced mood. And so we have sleep there, we have treatment. Not everyone who has bipolar disorder takes medication, but medication is very useful for those who do take it. Avoid recreational drugs. try and be positive, try and have structure, try and do things. Do get help sooner rather than later. Follow a regular routine, be well informed about bipolar disorder, and try and learn out, or try and find out rather, what triggers you have for bipolar disorder if you do get triggers. And then you can hopefully avoid the triggers in the future. And the last one says you can take control of this illness. I'm not sure that's entirely true. I think you can take more control of it, but you can certainly gives an indication of what is possible. All right, Alice.
Yeah.
Is that what you meant?
Yeah. Perfect. Thank you, John.
That's right. It was that good. So in the BEPC course that we run, the face-to-face course, we have an exercise before the family and friends session where the participants on the course write down messages they want their friends and family to hear when they're there the week after. So it's all anonymized, no one knows who says what. But we thought it might be useful this evening if we talked about some of the messages that came from the courses. And so Alice and I will go through them now. I may regret my actions. I don't want to hurt you. It may be hard for you, but imagine being me. My medication is important and I need to take it. Sometimes I'm unaware of my behavior. It's not my fault. I don't do it on purpose.
Yeah, so some more comments then from participants. So it may not be bipolar that's causing the issue. It's not always the bipolar causing everything. So seek information about bipolar, so as you're doing tonight, about symptoms, signs, medication and support. It won't go away. I'll never get better. I'll never be who I was before, but I'm trying my best. My will drains. I feel empty, disconnected, withdraw, lose my self-confidence, self-belief. I just can't snap out of it. I feel frightened of being ill. And I think that last one really kind of shows the power of the disorder itself, and how it, it's separating it from the individual.
We prefer positive support and encouragement to negative criticism or actions. Times are changing. Mental health won't always be such a taboo. Please don't be ashamed of us. It's not our fault. Involve us in decisions and liaising with medical staff or treatment decisions, but take the lead and contact them if necessary. And realize that some behavior, such as self-harm, might actually be hidden.
And some final ones then. So I need your love, support, friendship, in spite of what I might say. See the person before the bipolar condition. Be patient and please don't give up on us. The bipolar is rarely bigger than us as a person. And finally, thank you for being there, your help and support. We really rely on you, even more during relapses, but also helping us to keep well and stable. And hopefully that's a good one to end on there. From what we've kind of covered tonight. Okay, right, so that's the end of the presentation. So I think just to hand back to Simon at this point then.
Hi Alice and John, thank you so much for that. That was excellent. I mean, I learned so much from just watching that myself. I feel that sometimes a lot of pressure is put on friends and family, and there's a lot of guilt attached as well. I mean, it's very difficult to support someone to live well with bipolar if the person that doesn't take responsibility for the condition itself. And I think that is one of the key aspects of it as well. But from that, there's some really key things that people can do to help empower people to live well. And perhaps just being an enabler of those kind of good behaviors, like if you're thinking about a holiday, don't be super enthusiastic about going for clubbing in Ibiza, and it may be kind of choosing to go for a walking holiday in Wales might be something that's probably better for them helping to self-manage effectively. But I think probably the people who are watching here today, who have got loved ones with bipolar, you probably are doing a lot better than you actually realize. Even if this is the first time you've had this, you've been finding out about the kind of nuts and bolts of being able to help someone live well. I mean, we've done some survey work of our community, and we asked people what was the most important thing to help you stay well. And overwhelmingly it was friends and family, and friends and family were more important than psychiatrists, more important than medication, more important than even like bipolar UK services. So you're probably doing a lot better than you actually realize already. And there is support there. I mean, like there is not as much community mental health team support as there should be, but it is there in a crisis. So you are not alone. If your loved one is really unwell, it's you should be contacting your crisis team, and they should be the ones doing the heavy lifting on this, and not you. And if you need to, call 999 and get a psychiatric emergency response out, because that's what the 999's there for, and ambulances can come out and help you. So you're not alone. And also signpost people to our services, Bipolar UK. We work with the Manic Depression Fellowship, but it's obviously we're a reference there, which was great, our historic name. But sometimes you can feel that you're the only person providing that support, and actually, if they can become part of a community, and you're part of a community, then that kind of spreads a lot of the stress as well, because you're not alone. There's 1.3 million people with bipolar, and you probably know a lot more people living with bipolar than you realise. So, right. Questions. Lots of excellent questions were submitted before, and we've got Ian's there now as well, joining Alice and John.
I'll just say, Simon, I think we'd always encourage people to take a walking holiday in Wales. Any holiday in Wales is time well spent, but not at the moment, actually. So I think the Welsh Government aren't very keen on any visitors at the moment.
Oh, they'll be begging us to come back at some point soon, won't they?
We will.
Now, this is one of the questions here was about how do you know if your child has inherited bipolar, and that's a real big anxiety for people living with bipolar. But I think also it'd be worth talking about diagnosis on that, because it takes up to 8 years. It was 8.75 years. I don't know how they calculate it, but it takes a long time to get a diagnosis, and I think it's about 60% of people with bipolar don't have any specific treatment at all for the condition. And a lot of the time people will be living with bipolar and they haven't actually had a diagnosis. So I wonder if you just want to talk about the genetic aspects of bipolar, the hereditability, and then also how you would go about getting a diagnosis, and how friends and family could support that process.
Shall I say something about the genetics, and maybe Alice and John could say something about the diagnosis issue? We know, as came out in the fantastic presentation that Alice and John made, we know that the causes of bipolar disorder are a complex combination of biological, psychological, social factors. Yeah, and don't believe anybody that says that they know that there's just one simple cause of bipolar disorder, whatever that is. But we do know that genetic factors are involved, like they're involved in all illnesses, actually. So all kind of common illnesses like diabetes, asthma, heart disease, hypertension, all of these things have genetic factors that are involved. And it's no different with bipolar disorder. But what really important point to make is it's not just genetic factors. And the other point to make for people who may be worried about their children developing bipolar disorder is certainly we know if a parent has bipolar disorder, the risk is increased in their children, but still the overwhelming likelihood is that their children won't develop the condition. So as Alice said, that bipolar disorder occurs in 1 or 2 to 3, maybe even a higher percent of the population. In children of people with bipolar disorder, the risk is still only about 1 in 10, about 10%. So that, and turning that on the head, there's about a 9 in 10 or a 90% risk that a child of somebody with bipolar disorder won't develop bipolar illness. So I think it's really important to recognise that that's an issue, but to get to put it into perspective and get that balance right. Is that kind of the experience of people contacting Bipolar UK? Simon, do people tend to worry about that risk of passing on the condition to family, to children?
Absolutely, it's a huge burden to carry, and then people can't help but blame themselves if their child does develop bipolar, and it's entirely outside of their control as well. It's, as you said, there's some strong genetic underlying factors. I mean, I have a rare kind of genetic disorder which my daughter might inherit, but it's and I had to do a bit of soul searching after finding out about it, but it's not something which I have any control over. So and I think this is and we've talked about this a few times, Ian, as well, which is sometimes the guilt and the shame can actually end up being like a barrier to actually being able to live well with bipolar, and you can carry it around and ruminate on it, and actually it's outside of your control. But there is stuff that you can control. We've gone through it, like sleep, leading a sort of a good life, not everything in moderation. You can still drink alcohol. Some people with bipolar do drink alcohol, depending on the medication, but not doing it in excess and so forth. So it's kind of trying to focus on leading that good life that helps you live well. And all the stuff that we advise people to do, other than the medication, is all stuff that most people should be doing anyway to live well and to keep good mental health. But for people living with bipolar, you just need to be much more on top of your game on it, haven't you? Because it's like being an Olympic athlete. So getting a diagnosis.
Sorry,
Can I just say one thing on that?
Oh,
actually, just one thing I should have said about the other thing about that is because of that delay in getting a diagnosis as well. One of the things that if you have having children is that you can be aware of that and you can share, and watch out, and hopefully it won't be a situation where somebody takes 8 years, 10 years, 12 years to get the diagnosis and get the right help and treatment they need, but that can be picked up earlier. So that's one aspect. John, I interrupted. I'm really sorry.
That's right, mate. No, I was going to say about the paper that Simon referred to about the 8.5 year gap. I think that's more of a statistical thing, because I've known people who've had bipolar for 40 years before they get diagnosed, and people who've had it just symptoms for a few months. So I think that's how you might come to the 8.5 year thing. And getting a diagnosis of bipolar disorder can be quite difficult at first, because most health diagnosis goes through the GP first. Most people, if they're depressed, go and see their GP, but they wouldn't go to the GP if their mood was really, high or happy and they were euphoric. And sometimes GPs don't always ask the right questions about, what's it like when you're not depressed. So I think there's a diagnostic difficulty there. Ian, is that right from a medical point of view, would you say?
Yeah, I think that's bang on. Your GPs are married to one, so I know this very well, that they've got 5 minutes to see people, 10 minutes to see people. And actually, you're right, John. I think people don't go talk to their GPs when they have high mood. So it does depend on GPs asking those right questions, which often isn't done. So yeah.
But in GPs, GPs have a lot of work to do. They cover all host of illnesses, and they can't be experts in all of them. So could have a bit of slack.
We also advise people, and apologies for lots of people who've actually been through the diagnosis process, and this is kind of rehashing old stuff, and can be quite a difficult, painful memory. But certainly it's difficult to go to a GP and actually say, these are my symptoms, I think I have bipolar, because GPs don't like to be told that someone's kind of diagnosed themselves. So you almost need to kind of lead them up the garden path by describing your symptoms and letting them come to the conclusion. So we spent a lot of time coaching people through that process, and it could be something that if you're on this call now and you're thinking about how you would get your loved one to get a diagnosis, you often have to play a bit of a game, and you just need to describe the symptoms rather than actually saying that you think it's bipolar. So
you've seen it on the internet. You looked on the internet and you diagnosed yourself with bipolar.
So let's bring Alice in on this. So these are all questions that have been asked so far. And are there any specialist therapists who are available online who are trained in experience of bipolar disorder? Is that something you could help with, Alice?
Not sure on that one. I don't think so, to be honest. I work more on the kind of research side of things. Obviously, John and Ian work more on the kind of clinical side of things. But yeah, I guess I don't know if you'd have any ideas. Sorry to field it back to John and Ian, but I don't think I'd have any ideas on that one, I'm afraid. Sorry.
There's lots of psychological approaches for depression and for anxiety disorders. For the elevated mood, there's less psychological approaches, but interpersonal and social rhythm therapy is coming out to be a very useful therapy, and it includes things like structure and routine and monitoring your mood. So I think that's a good approach. I'm not sure how many therapists are trained in it. A lot are trained in CBT, and CBT can be useful for depression, but it's not for everyone.
What does Bipolar UK give advice to people seeking to get a therapist? Because I think the question was about an online therapist as well, wasn't it? Yeah.
I mean,
do you give any advice about? Because I think there's lots of people out there selling their services, I guess, isn't there? And it must be, to get the right person is really difficult. I'd have thought.
Yeah, it's. I mean, we've signposted people to. There's a directory of therapists that's linked to Happyful, and you can find you can try. I mean, at the end of the day, it's your relationship with your individual therapist is what matters. And some people are obviously, if they've got lived experience of bipolar, or they've done lots of research on the condition, then you might well be kind of drawn towards them. But a lot of the time, it will be kind of your relationship with them. And it is, I mean, therapy, psychotherapy is really helpful, especially if it's dealing with the trauma that might have triggered the bipolar to kind of manifest itself in the first place. So I think one of the issues with therapy, and the question was about online services, a lot of therapists have been reluctant to use Zoom because and some GPs have as well, and other health practitioners, but actually it has been actually really effective. We found our support groups, we've had to, unfortunately, all the face-to-face ones are on hold at the moment because of COVID, but we moved a lot of them online through Zoom, and that actually has been really effective for the people using it. Now the question is, could you strike up a rapport with someone just straight up on Zoom like we are doing now, or do you need to have those face-to-face sessions that beforehand to really kind of build up the level of trust? And we've been lucky with our groups that people knew each other beforehand, but I would recommend it. If you go to Happyful and you go into, I think, director of psychotherapists, we'll have a number there, and a lot of them are still doing it online with Zoom. There's a lot of questions that have come in about menopause and bipolar and medication and bipolar, which is fantastic because we're going to be doing some future sessions over the next couple of weeks on those, which will be on our website and on the Cardiff University's website as well. So we'll part those for the moment, so that those will get answered later. So apologies in advance on that if you had some burning questions in that area, but there are some really excellent questions elsewhere that other people have put forward, which we'll cover now. So hypomania. Now, this is a really interesting area. When I was researching bipolar, when I took this job, I was kind of struck by it. This is, do you have any specific advice for a person with a hypomania diagnosis? And my understanding is hypomania is one of the states. It was on the mood scale between mania and a kind of stable state, but it can be a really productive time for people with bipolar as well. And it's one of the questions that, can people in a hypomanic state actually have an advantage over other people? That was one of the other questions that was asked. So does anyone want to, Alice, I'm determined that it's not just going to be the bloke speaking, so I'm going to come to you first, and you have first refusal. Maybe your research is touched on this very topic.
Yeah, no, it is. Yeah, very interesting question, actually. And I guess, obviously mania is what we think of when we think of bipolar, quite often bipolar type 1 with the manic episodes alternating with kind of depressed episodes and more stable mood. But that kind of hypomania kind of symptoms may go less or more kind of under the radar, I guess, than those manic episodes, which may cause very obvious impairment in someone's life. It might lead them to require kind of crisis team involvement or inpatient admissions possibly more often than those kind of hypomanic episodes. So yeah, it's a very interesting one, and one thing which, to be honest, did come up in the research when I was interviewing people previously with experience of bipolar, that sometimes those kind of hypomanic symptoms, yeah, they could be very productive and survive or get by on very little sleep, and sometimes whether they wanted to kind of seek help for those when it wasn't causing impairment that obviously needed treatment to others. Yeah, it's a difficult one because obviously it is a symptom of something not being quite right, and does need treatment quite often. But yeah, when you're in that place and you feel very productive and very full of energy and everything else, it perhaps doesn't feel that way at the time. But yeah, I don't know if John and Ian, you want to talk a bit more about the need for treatment when you're experiencing those types of symptoms.
John?
Ian?
John?
Ian? I was going to say, just because one is further up the scale than another one doesn't mean the one further on down isn't as significant to a person's life, because it can, even though it's hypomania, it can be quite disruptive to a person's life. But yeah, we've met lots of people who have hypomanic episodes, and they say they're very creative. They can do the work of 10 people. It's about trying to make sure that period of hypomania doesn't go into anything bigger, as Alice was saying.
Yeah, I agree completely with my two learned colleagues. What I would say is I don't know if you agree, John, but it's very, very unusual for people to just have hypomanias, not suffer some of the downsides of the diagnosis. Yeah. So for people who experience, and we'd all like a little bit of hypomania in our lives. I think if we, if we could have that as our default position, it wouldn't, as Alice said, it would, can be quite a productive way to be. But the downside is that usually after that comes an episode of low mood that can be really significant for people, or that hypomania may not just stay at hypomania, but they might creep up and become a more severe high episode that causes impairment and problems itself. So agree entirely, yeah. But actually, it might be a sign that there's something that getting help for, help with that mood state might help some of those other episodes that are problematic.
Yeah, and I was just going to add to that. Actually, it occurred to me that when people have talked about hypomanic symptoms that they've had, even though at the time they might have thought it was great, perhaps when they've come out of that state, they've thought, oh gosh, I was very kind of perhaps socially inappropriate with people, or kind of did things that perhaps later on they thought were quite out of character for them, and perhaps they felt a bit embarrassed about, or things like that. Not that they should, but yeah, I guess in kind of hindsight, looking back.
I think the prime example would be Tony. I think Tony Abbott, who I think it was the guy who wrote Shameless and State of Play. I think he wrote both of them in the space of 6 months in a hypomanic state, and then he was obviously kind of out of action for quite a while after that. But what an amazing achievement during those 6 months. Couple more questions. Couple directed at Bipolar UK. So, are you at some point able to increase Bipolar UK's counselling service? We don't kind of formally provide sort of trained counselling service, but we've got our support groups, all about peer support. So you can talk to someone with lived experience, either someone with bipolar or someone who's got a really close family connection with it, like with a parent or a sibling or a loved one. So that's a real part of what we do. We are looking to develop new services. Another question about whether we are looking to provide potentially work mentoring. We want to try and reach out to more people so we can do the telephone callback service. So we do provide that. So if you want to speak to anyone on the team, you go onto the website, we've got a chat bot, and you can actually book an appointment to be able to speak to a person, and they'll be able to provide not trained counselling, but they can signpost you to the right services. But they can also listen, which is really important, because sometimes you, as I said, you've probably never ever spoken to someone else who's affected by bipolar or been through what you've been through. But doing the calls and also joining our support groups, you'll be able to find more people who have been through similar things. Obviously, we want to help more people. We probably reach about 100,000 people every year. And there's 1.3 million people. If you do the 2%, not the 5%, if it's 5%, you're probably talking about 5 or 6 million, or 2.5 million, isn't it? So I'm sure some mathematicians there. But there's a hell of a lot of people out there living with bipolar that don't get any support. So what we are doing is, because we want to run these sessions for free in the future. If you do want to make a donation so we can reach more people, we've just put a little link in Zoom if you want to make a £5 text donate, and that would allow us to then to reach more people. So I think Kat is going to be putting that into the chat now. If you don't have any money, there's really no stress at all. There's no pressure, because a lot of people with bipolar don't have a lot of cash at all. It's just if you want to give, do it. It's like a tip, but there's absolutely no pressure at all. We'd always want to run these sessions for free, because it's really important that if people can't afford it, that they can still access these services. And this will all be uploaded onto YouTube as well. So you're more than welcome to watch this at your pleasure anytime and signpost other people to it. So we've got 4 minutes left. Let's have a look to see if there's some great questions. Cyclophonia, I think that's the way you pronounce it. Is it different from bipolar, and what are the differences?
John, Alice, do you want to take that? Cyclophonia?
Can I say what I think it is, Ian and Alice, and you tell me if I'm wrong?
Yeah, we'll jump in and tell you.
I'm sure you would.
Don't worry about that.
Okay,
Yeah.
so I see bipolar as a spectrum where you can have very big symptoms and very small symptoms. So bipolar 1 sort of catches very big symptoms, bipolar 2 catches the hypomania with the depression, and cyclothymia catches things beyond bipolar 2. I mean, you know, it's normal for everyone to have changes in mood. That's part of normal human emotion, isn't it? But cyclothymia, I think, is just that little bit added on before it gets into a bipolar 2 disorder. But I think it's cyclothymia, I think, is part of the bipolar spectrum, Ian. There we are. That's what I was going to say.
I think that's a good answer, John. Alice, you got anything to add to that?
No, I don't think so.
And I think like many conditions, like many aspects of life, sometimes the boundaries between these things are a bit fuzzy, but that doesn't. Yeah, I don't think that's a problem. And cyclothymia merges into bipolar 2, which merges into bipolar 1. So, and that's often the problem clinically. Sometimes is to try and work out what's happening at those boundaries. But I think John's put it really well.
Brilliant, thank you. We've got 2 minutes left, so some excellent questions here. Hopefully, I understand who's hosting this. You'll be writing these down and we'll be sending it round to everyone who's signed up, because I know we've already done some written responses to the other ones. So if we're able to do that, because I think it's really important we can get a response to everyone who's asked a question, because they're all excellent. So there's one about mania. Any hints on living with someone in mania during lockdown?
Ian?
John, I think that's yeah.
No. Gosh, it must be hard work at times. I don't know. It's yeah. Ian?
Yeah, I think you covered some of those things in your talk, didn't you? That you've got to give yourself a break. Actually, and I think as Simon said at the start, there's you can't take this all on your own shoulders. That getting help from clinical teams, getting help from organisations like Bipolar UK, and support from where you can get is really important. Not to feel the guilt that often comes. I think people with bipolar disorder often feel incredibly guilty about their condition, but I think people who are your families of people with bipolar disorder sometimes feel that guilt as well. That so look after yourself. Recognise that actually sometimes how people with bipolar will behave when they're in a severe episode is the illness, it's not them. So hopefully try not that let it affect your relationship. John, did you want to come in there?
I was just saying, it must be really difficult. The person you love is giving you, saying unpleasant things to you. How did you not stop that hurting you? What we say in the group is we talk about compassion fatigue. Everyone has a limit how much compassion they can give to someone, and we say, give yourself permission to take a step back and get out of the situation if you need to, because your own health, you won't be able to, as Alice said before, you can't, what was that phrase you said? You can't give out of a bottomless cup or something.
Can't pour from an empty cup.
Yeah, and this is exactly right, really, isn't it?
Simon, have you got advice from the experience of Bipolar UK to give?
So I would say our e-community is available 24/7. It's moderated during the day, and it's a good space. So if they need an outlet to be able to talk to other people, that could be a good way for them to get typing and to be able to let some of those energies out in that direction. And then obviously we've got our support groups online and Zoom. So I try and encourage them into that direction and to be able to have that kind of awareness. But it must be incredibly difficult. I mean, we've certainly found that people's self-management regimes have just been like really kind of torn to shreds because of lockdown, and it's not their fault because they're not able to get out and get the exercise they would want to maybe, or even get access to the medication they need, or get the medication reviewed. But there's always a crisis team. I know they're not, it's really hit and miss, and they're there in an absolute crisis, but you might be lucky in your area and you might be able to get in touch with them, and they might be able to come around and send a psychiatric nurse round, and they might be able to give some advice and perhaps look at changing medication. But I mean, that it's a really tough place to be in. But we're at the end of our hour now. We could go on for longer, and I really hope that this is the start of many more conversations. So those of you who attended, thanks so much for joining us. We've really enjoyed this, and we've covered a lot. And we're doing another one. We've got quite a few lined up actually. We've got one on Tuesday next week, which if you go onto our website, you'll be able to register for, which is about being your best with bipolar, which is people living with bipolar, talking about how they've managed and how they've overcome challenges and built their careers. So that's would be really, really interesting. Hopefully a bit of a pick me up. It's quite a difficult time for all of us. But there will be follow-up ones over the next couple of weeks. So check out our website, and we've got them listed. And if you've registered for this one, I'm sure that you'll get a reminder for it as well, and we'll send it around. One of the things that we're really excited about is Cardiff University, because one of the questions is about the course, the BEPC one that's referenced, is that they're currently piloting it on Zoom. So the hope is that that'll be done over Christmas. So, I mean, it'd be great. We really want to work with Cardiff on this, and we'll be trying to raise money to be able to get this out to more people. But certainly, we're committed to running more of these courses over the next 6 months. If Cardiff, we can get your good time, I'll be here. So I think it's a really great opportunity to bring people together as well, because you can often feel quite isolated and alone, especially during lockdown, and just being able to shoot the breeze of other people who have been through similar things is so powerful. Do you want to just say,
Simon, the questions that we didn't get to, we'll try and look through and put up online the answers of the ones that we can. Yeah,
that'd be great. And if we'll put ours, and it'd be really good to get your team's input onto those. So yeah, we'll get a response to everyone who's asked a question. Let's end on a positive note. If you're living with bipolar, you're amazing. You're an Olympic athlete staying well, and this is a really difficult time. If you're a close family member of someone with bipolar, you're helping them stay well. You probably do not know how much you've done to help someone in their life, and just being a partner or a husband or a father or a daughter or a son, or even a friend. I mean, you're doing something amazing there as well. So congratulations, and I hope you found this useful. Any other follow-up words of glory and hope for the future from our wonderful panelists?
For me, I think you summarised that brilliantly, Simon. Just to thank you and Bipolar UK for working with us on this as well. We really, really appreciate the opportunity to collaborate on these webinars. So thank you to Bipolar UK.
Thanks. And we can always improve. So any feedback you have, please do email it across. I think we're slowly getting better, but all feedback, things that you'd want more of or less of, then do let us know. But I think that's it. So we'll just all say goodbye and hope you all have a really wonderful evening. Thank you.